If you are new to my channel and want to educate yourself more about herpes viruses, please like my videos and subscribe to my channel. Make sure to ring on the notification bell so that you'll be the first to watch my uploaded videos every day. Let's put an end to the herpes virus.
Herpes simplex keratitis Valtrex dosage. Steroids play a role for treatment in some patients. Patients with herpes simplex virus, HSV, keratitis can present some of the most challenging cases that eye surgeons treat. Once they delineate the type of HSV keratitis the patient has, clinicians must decide on the most effective use of antiviral medications. This may mean a choice of oral versus topical antiviral medications, combining antivirals with corticosteroids when appropriate, and prescribing antiviral medications as prophylaxis indefinitely or before surgery. Although some clinicians have clear guidelines as to when to use antiviral or steroid treatment and what type of antiviral or steroid treatment they will use, others still struggle to manage this. Here are some pros and cons on the use of oral versus topical antivirals for treatment or prophylaxis in patients with HSV keratitis and when it is appropriate to administer corticosteroids. Topical versus oral. A patient with HSV on the eyelids or in the cornea in the United States will commonly receive the eye drop Viroptic, trifluoridine ophthalmic solution, 5 to 9 times a day for 1 or 2 weeks. Internationally, a topical form of acyclovir, Zovirax, GlaxoSmithKline, Middlesex, United Kingdom, is available. Physicians may also choose to use an oral antiviral medication, such as acyclovir 800 mg 5 times a day. 1 gram of Valtrex, valacyclovir, GlaxoSmithKline, 3 times a day, or 500 mg of Famvir, Famciclovir, Novartis, East Hanover, NJ, 3 times a day. The oral treatment is usually taken for 7 to 10 days. Sometimes we treat with the drops and not the pills. Other times we treat with both to blast it. Oral treatment. It's very safe, and compliance is easier with 2 to 3 times a day versus 5 to 9 times a day with drops. More cautious with the use of oral antiviral treatment in pregnant or expectant mothers or in patients with kidney problems. The topical treatment can lead to some scarring and nasolacrimal duct obstruction, more reasons that lead practitioners to favor the oral medications instead. Plus, the topical forms do not usually penetrate as well as the oral antivirals when treating endotheliitis, one form of HSV keratitis. In herpetic patients with infectious epithelial keratitis, favors the use of topical and oral antiviral treatment along with debridement of the lesion. Treating the patients with antivirals as fast as we can and debriding all play a role in reducing the viral load to the stroma. Corticosteroid treatment. Despite concerns about treating herpetic patients with corticosteroids, research shows that they are a helpful part of the surgeon's armamentarium. The Herpetic Eye Disease Study HEDS in the 1990s delineated a number of features that may have not reached clinical practice. This includes evidence to show that the benefits of corticosteroid treatment appear to outweigh any of their associated risks in these patients. For example, a patient with HSV stromal keratitis may receive steroids to reduce inflammation and remain on oral antivirals while they are using the steroids, to help reduce the risk of recurrence potentially triggered by steroid use. Clinicians are taught about the complications of steroids, such as cataract formation and IOP spikes. However, without steroid treatment, there's a greater risk for corneal scarring. Keeping patients on steroids at a level above their flare dose to help prevent HSV recurrences. If you put steroids on a live virus, it's like putting gasoline on a fire. It'll spread more. Cautious with steroids in a red eye because it could make things worse. That the careful use of steroids combined with oral antivirals is the best treatment course in patients with HSV stromal keratitis. Preventing recurrences. Patients with certain types of HSV are prone to recurrences. Some research, such as that from the HEDS investigators, indicates a role for oral antivirals to prevent these recurrences. The more times you've had herpes, the greater chance you'll get it again. There's good evidence from the HEAD study that shows oral antiviral pills, such as the use of long-term acyclovir, can significantly reduce the risk for recurrences. The HEDS investigators found that long-term prophylaxis with oral antivirals can reduce recurrences by 50%. Antiviral prophylaxis decreased infectious episodes by 44% in non-atopic patients with HSV and by 76% in atopic patients. Antiviral prophylaxis for HSV recurrences was more effective in reducing infections in atopics and less effective in reducing inflammatory episodes in atopics versus non-atopics. Long-term oral acyclovir for patients with multiple occurrences of HSV that each require corticosteroids. 2. Recurrent inflammation with scarring or neovascularization that approaches the visual axis. 3. More than one episode of necrotizing keratitis. Or 4. A history of herpetic eye disease and a corneal transplant. Outcomes are usually poor in those patients, but with the use of acyclovir, the outcomes are excellent. In patients with recurrent herpetic episodes, it's better that you stay on antivirals indefinitely, because the consequence of another infection is that you'll lose the vision that we saved. If patients with herpetic episodes must undergo eye surgery, antiviral prophylaxis one day or a couple days before surgery, combined with post-op use for a couple of weeks, is another helpful measure. The trauma after surgery could cause an increase in the inflammatory response.
Thank you for watching. And please subscribe to my channel for my upcoming herpes treatment videos.